The COVID-19 variant XBB.1.5 appears to be the latest to have taken hold here. It has been found in a majority of patients testing positive for the virus who have developed severe acute respiratory infection. But what do we know about this new variant, which has been found here since January? The XBB.1.5 is another descendant of the Omicron variant, and it has grown out of the offshoot XBB, which arrived here last year. It has been described as the most genetically rich and most transmissible. XBB.1.5 has a mutation which allows it to spread more easily, and it is better at evading immunity to infection. The World Health Organization said it has a large growth advantage over other subvariants so far. It is circulating in many countries, and recent reports found it particularly common in the US. The Health Protection Surveillance Centre, the HPSC, said that the new variant is not reported to be associated with increased severity of illness. We already know there is a high level of protection from severe disease among the population due to vaccination and previous infection. Nevertheless, the over 65s and people who have a weakened immune system due to underlying conditions remain the most vulnerable. The HPSC said that over last year and so far this year, heart disease has been the most frequent pre-existing condition among those who got COVID-19 and presented to hospital. Early data from last November, gathered by the US Centers for Disease Control, found that the bivalent booster jabs which are used here offered reduced risk of being hospitalised. While it is not yet known if they are as effective against this subvariant, they are sure to offer good protection. PCR testing centres around the country have now been closed. The HSC said that most people do not need a test and advised people to stay home if they have symptoms. Those who are at a high risk from COVID-19 are advised to contact their GP urgently if they have symptoms or a positive antigen test. A GP can prescribe antiviral treatment to prevent deterioration on the basis of an antigen test. If a GP is worried that an at-risk patient has more serious symptoms, they will be referred to a hospital for a PCR test. The general advice for anybody if they have symptoms of COVID-19 or any other viral respiratory tract infection is that they should stay home and limit all contact with others until 48 hours after their symptoms have been resolved.